So, I hear you recently had a premature pregnancy and have some concerns. Tell us about that.
Yes, we did. Our twin girls came into this world a little early, and we heard that that can cause some heart complications for me.
We're going to the doctor tomorrow to see if he can give us some more information.
I currently don't have any heart or cardiovascular conditions, but I do want to know what to look for.
The more information we can find out, the better prepared we can be to prevent any of these issues.
Mr. and Mrs. Cody, you can come on back.
Good evening, Mr. and Mrs. Cody. Here's a fact sheet before we get started. I hear you had some questions for me about your recent premature delivery. First, tell me a little bit about yourself.
I'm 22 years old and I'm now a stay-at-home mom with our newborn twin girls.
Recently, we've been seeing some health articles on Facebook. You know how the algorithm gets.
Yes, I saw that women who deliver preterm have been reported to have increased future risk of cardiometabolic disorders.
Yes, some studies have shown increased future risk of cardiometabolic disorders in women who have given birth preterm.
Can you tell us about some of those specifics?
Yes, but first, do you know anything about cardiovascular disease in women?
Yes, I know that cardiovascular disease is the leading cause of mortality among women in the U.S. and worldwide.
I know that preterm delivery and other pregnancy complications have been identified as risk factors for cardiovascular disease in women.
You're right. Women who deliver preterm have been reported to have modestly increased future risks of hypertension, diabetes, and hyperlipidemia, which are major risk factors for ischemic heart disease, or IHD.
I see here from the results of a study that between 0 to 43 years after preterm delivery, each additional week of pregnancy was associated with a 6% lower risk in IHD.
Yes, based on that study, a mother's likelihood of developing IHD was higher the earlier she gave birth during her pregnancy.
We also heard that preterm delivery and resulting IHD could be due to shared familial factors.
So, is it true that there is any connection between siblings or other family ties?
No, I don't think so. There are no prior issues in our family or even in my former pregnancies.
Overall, the findings from that same study suggest that any preterm delivery and resulting risk of IHD are not attributable to shared genetic or environmental factors in families, although IHD can be genetic in and of itself.
So, what can I do to prevent my likelihood of developing IHD?
Women who deliver prematurely need early preventative evaluation and long-term monitoring for IHD. A healthy diet that involves limiting saturated fats, trans fats, and sodium, and involves eating more fruits, vegetables, whole grains, and lean proteins is a good place to start.
It also says here that exercising regularly, maintaining a healthy body weight, avoiding smoking, limiting alcohol consumption, and managing stress can all help too.
At the bottom of this handout, I also see some additional facts on the effects of preterm birth on women's heart health. Hey, I'm Bria Cody. What's your name?
Hey, I'm Sophia. I haven't seen you in here before, and I have to come in quite often. When you get to my age, you'll understand.
Well, I'm sure I'm not too much younger. I'm 62 years old.
Really? I'm 55. What's your secret?
Well, after my preterm pregnancy that I had in my 20s, my doctor gave me some pointers to keep myself from developing IHD, especially since my premature delivery put me at higher risk. I'm just here for a checkup.
Oh, really? I also had a premature pregnancy, and I've been experiencing some of the symptoms suggesting that I may develop IHD. Please tell me what I can be doing to live a healthier life like you.
By now, you know that preterm pregnancies can put the mother at higher risks of developing heart disease and other heart issues in their future. Additionally, other studies have shown a 40% increased risk of self-reported myocardial infarction or stroke among those who delivered preterm. If you or a loved one have experienced a preterm pregnancy, please refer to our fact sheet and make the effort to do your part in mitigating the risks before it's too late.